Gallbladder cancer is an aggressive disease that is often difficult to treat, primarily because it is frequently diagnosed at an advanced stage. Today, we'll look at the risk factors, symptoms, and the current landscape of treatment and research. What leads to gallbladder cancer? Chronic inflammation is a major driver. Key risk factors include gallstones, gallbladder polyps, and porcelain gallbladder, a condition where the gallbladder wall calcifies. Other factors include obesity, a family history of the disease, and even chronic infections like typhoid. Demographically, we see specific trends. It is significantly more common in women, who account for roughly 71% of cases, and incident rates are notably higher in Latin America and Asia. While it can affect various ages, it is most frequently diagnosed in those aged 85 to 89. Symptoms can be subtle at first, often starting with abdominal pain. This can range from a persistent dull ache to sharp, intermittent cramping that may radiate to other areas. As the disease progresses, patients may experience jaundice, yellowing of the skin or eyes, nausea, vomiting, and bloating, unexpected weight loss, fever, or night sweats. Because the gallbladder sits near vital organs, the cancer often affects the liver, nearby lymph nodes, the small intestine, and the stomach. To detect the disease, doctors rely on advanced imaging, including ultrasound, CT scans, MRI, and cholangiography. An FDG PET CT scan is often used to see if the cancer has spread. Staging is based on the tumor size and location. It begins at stage 0, carcinoma in situ, where the cancer is only in the inner lining. Stage 1 and 2, the cancer grows into the outer layers. Stage 3, it reaches nearby organs or lymph nodes. And lastly, stage 4, this involves large tumors in multiple organs or spread to distant parts of the body. Generally, the lower the number, the better the prognosis. Treatment depends on the stage. Surgical options include a cholecystectomy to remove the gallbladder, or palliative surgery to relieve symptoms. Other treatments include adjuvant radiation, chemotherapy, and biliary drainage. Current research is focused on combined modality therapy. Investigators have found that using specific chemotherapy drugs alongside radiation often work better than using either treatment alone. Researchers are also refining how to best integrate radiation with surgery to improve outcomes. The road to recovery requires diligent follow-up care, typically every 3 months for the first 2 years, then every 6 months for the next 3. Survivorship remains a challenge due to the aggressive nature of the disease. Currently, about 30 out of 100 people survive for at least 1 year, and more than 10 out of 100 survive for 5 years or more. However, with ongoing research into combined therapies, the medical community continues to seek better paths forward for patients.